There is a certain national trait, probably in every country in the world. Everyone always complains about healthcare. If you watch any video review about any country on YouTube or read descriptions on social media, people always say that healthcare is bad for various reasons. When I talk to our customers, even from the United States, even from Israel and Germany, they say, we don't have healthcare at all, it's terrible. Even though these countries are known for having the best healthcare. In today's video, we'll talk about this. And we'll figure out what the level of healthcare is like here in Northern Cyprus, whether it's good or absolutely terrible. Be sure to watch this video until the end. At the end, I'll share a few stories from my family's life, both positive and negative, about the level of healthcare in Northern Cyprus. I'm sure it will be interesting and useful. The question of healthcare in Northern Cyprus is especially important. Why? Because who comes to Northern Cyprus? People come either to give birth and raise children, to raise their children here, or people who are already of retirement age. Because there's a good climate, good environment, safety, and a very high level of healthcare and education. Young people, when they finish school, feel like something is missing. In Northern Cyprus, there's not enough activity, not enough infrastructure, nothing new or interesting, and they try to leave Northern Cyprus to some bigger countries, to more developed countries. And then when they start a family and plan to have children, if, for example, their parents are still here, or if they still have property, they come back to Northern Cyprus and spend the next 10 to 12 years here in Northern Cyprus when they have kids. That's why for Northern Cyprus, the issue of advanced healthcare is very important. And that's not even mentioning the fact that medical tourism is very well developed here. Thousands of people come to Northern Cyprus for medical treatment every year. Yes, all sorts of people. All sorts of people, because the prices are noticeably lower, not just compared to Europe or the US, but even compared to Turkey itself, they're significantly lower. The standard is very high and the equipment is very modern. There are no queues at all, which is why even our relatives and our clients come here. They specifically come to Northern Cyprus bringing their parents and friends precisely so they can get checkups, receive treatment, or even have some kind of surgery here in Northern Cyprus. There are countless such cases. I suggest that we rely on some objective facts rather than just positive or negative stories. For example, life expectancy. For instance, the presence of serious infectious diseases in the country, how we went through the COVID-19 pandemic, the availability and accessibility of medical facilities, medical staff, as well as the availability and accessibility of medical equipment and medicines. I believe that these facts will tell us much more than just rumors and gossip. First, the presence of serious infectious diseases. Well, there are none in Northern Cyprus. I mean, HIV, syphilis. 3 types of hepatitis and tuberculosis. Why aren't they here? Because the government and the people are very afraid that on such a small island, if some kind of epidemic appears here, it's unclear how we would protect ourselves from it since the distances are so small. All foreigners, every single one, whether they do business here, work in Northern Cyprus, are students, or just live here with a residence permit, undergo a medical checkup annually and regularly. And if we see that a person has one of the aforementioned diseases, they simply won't be allowed to live here. Here in Northern Cyprus, I don't know if there is mandatory regular medical screening for local residents, for citizens of the Turkish Republic of Northern Cyprus. I haven't encountered this myself, but I see that they themselves, at the very least voluntarily, regularly undergo medical checkups as well, since there are plenty of opportunities for that here. There are many options for this here. Secondly, Northern Cyprus went through the COVID-19 pandemic successfully and was either the first in the world or among the first to do so. We defeated COVID. I don't know for sure because our country wasn't included in the official statistics. We saw how dire the situation was, how the healthcare systems of European countries and the United States, and how terrible things were in South American countries. The mortality rate there was extremely high, and their healthcare systems simply could not cope with this challenge. In Northern Cyprus, everything was fine. This is an objective indicator that the healthcare system here works very efficiently. And besides everything else, there is one pleasant nuance. You go to see a doctor, you pay him for the appointment, then after that you don't pay anything else until he cures you. That is, you come back for follow-up visits. If you need another follow-up, as long as he hasn't cured you, you don't pay him again. Well, not counting your expenses for medication and any additional tests. So the system is set up in such a way that it's in the doctor's best interest to cure you as quickly as possible so that you are healthy and no longer sick. I really like this a lot. In Northern Cyprus, there are several dozen state and private clinics, polyclinics, and just individual medical offices. So there is both an efficiently functioning public healthcare system and private healthcare. Moreover, most doctors work in state clinics from morning until noon, and from noon until evening, these same doctors see patients in their own offices or in private clinics. Furthermore, there are several medical faculties at universities in Northern Cyprus. In other words, qualified professionals are trained here. This happens right here in Northern Cyprus. We are not dependent on importing these specialists. Moreover, in university-affiliated clinics, more than 75% of the doctors are professors. This means the level is very high and seeing them is not very expensive, which adds to the appeal of healthcare, specifically in Northern Cyprus. The medical equipment in Northern Cyprus is surprisingly advanced. Even though Northern Cyprus is like one big village, the equipment is the latest and of the highest quality. I know several examples. For instance, at Near East Hospital, they have a diagnostic device for heart diagnostics. There are only 5 of these in the world, and I think 2 or 3 of them are here. One is in the USA, another one, I don't remember where, and one is here with us in Northern Cyprus. Or at least that's how it was when it was first acquired. Or for example, our dentist. It's not exactly medicine, but it's very close. I remember when I went to see him, when he moved to a new clinic, he opened a big new clinic. By the way, he has Russian-speaking doctors working for him, so if you ever need one, let me know and I'll recommend him to you. He has been practicing at the highest level for over 30 years. He's a very, very knowledgeable and professional doctor, and this clinic looks more like some kind of spaceship. So when we go in throughout the entire place, in the common areas, about 60% of the air is filtered, absolutely clean. And when we go into the rooms where the consultations take place, it's 90% pure air. He gave me a tour, as is customary in shoe covers, and showed me everything. He said, look, do you see this device? I think it was a 3D X-ray machine. I believe this conversation took place in November. He said that global sales would only start in February of the following year. So just a few months later, we already had it up and running. I asked him, how did you manage that? He said, we placed a pre-order. We ordered it back when they had just started manufacturing them. So we've already received it, we have it here now, and this is in our, let's say, rural hospital. Moreover, almost every doctor that my family and I have to see has not only a diploma of higher education, but the entire wall is covered with various diplomas and certificates showing they've had postgraduate education. Various kinds showing that they attend different medical conferences and not just locally. For example, our neighbors, Southern Cyprus, Turkey, the UK, many continue to travel, study, and do internships during their vacations. For instance, specifically in the UK, as well as the United States, Belgium, and Germany. They are constantly learning, which is very, very good, and the technology is truly of the highest level. We even had a situation once that surprised me a little. A doctor came from Moscow, an elderly gray-haired gentleman, a real luminary in his field. He's a big name there already. They don't let him leave his specialty there either. He's simply the best of the best. So they were looking at real estate here. He said, well, why would I move here? I have patients back there. And he's a pediatric doctor. I won't specify the specialty. He said, if you find me a job here, I'll move. If you don't, I'll just relax and go back. So we went to one of our private rural clinics that matched his specialty. We arrived there and I introduced him. He doesn't speak English, so I was the only one in our office at that moment who spoke English. I went as an interpreter, so I'm translating, saying, here's a renowned specialist in a certain field. Will you hire him? The local doctor says, of course, we'll hire him, no problem. You can start working as soon as tomorrow. And then they just started talking to each other. And our local village doctor asks, do you do this? And the Russian-speaking specialist through me says, no, I don't know how. And this? No, I don't know. And this here, this? And he couldn't do any of the above, which are all part of the standard list of procedures here. I started to feel really uncomfortable. Later I asked him, I said, listen, how come? Well, you're a renowned specialist there, but and here it's just a village doctor. If the local doctor does more than you, what's the catch? I said I was blushing all over and sweating from nerves. He said, well, Igor Vladimirovich, that's just how our system is. That's how it works for us. We're more specialized, and these technologies just haven't reached us yet. But here, they have, and the doctors are more broadly skilled. It's just different, that's all. By the way, what about you? Have you had any good or bad experiences with medicine in different countries? Please write in the comments below this video. Unfortunately, our family here in Northern Cyprus and our company as well have had to call for an ambulance more than once. Our experience has been that they arrive very quickly, almost instantly in fact. They work very professionally, and their ambulance service, it's free. And in their ambulances they have, I don't want to say it's the most modern equipment, I don't really know about that, but they really have everything you need. They have computerized equipment and their system is connected throughout the whole country. So by entering the necessary data, they can immediately see where the patient needs to be sent. And they can instantly register the patient so that everything happens very quickly and efficiently. Overall, I was pleasantly very surprised when I ended up there one of the previous times. I thought the level would be like that of a typical small village hospital. The ambulance service is much better than I expected. Thank God the standard is very high, and that's wonderful. We've never encountered any shortage of medications here in Northern Cyprus, which is nice. Well, at least everything I've ever bought here was sold to me without a prescription, and instantly at that. There was never a situation where a medication wasn't available or couldn't be obtained. As far as I understand, Kentrofen, there are no counterfeit medications in Northern Cyprus, and most of them come from Turkey and the United Kingdom. There's also Germany, Bayer, for example, but mostly it's the United Kingdom and Turkey. As for prices, well, at least before the Great Continental War in Europe, our parents used to compare them. Well, for them, because of their age, they have to use a large number of medications, and they compared the prices in the Russian Federation and here. So I don't know how it is now, but before the war, prices here were exactly 3 times lower. That's why our parents used to stock up. They would buy a large amount of medication here and take it with them just to save money. The average life expectancy in Northern Cyprus is 78 years for men and 83 years for women. That ranks 29th in the world. For example, Turkey is in 80th place and the Russian Federation is in 165th. Northern Cyprus is ranked 29th in the world for life expectancy. In my opinion, that's wonderful. Of course, I've heard both good and bad reviews from our customers and acquaintances about the healthcare system. Here in Northern Cyprus, I'm sure there really are both good doctors and complete idiots. Probably that's true anywhere and in any field. By the way, share your own stories in the comments under this video. We'll be able to look at these questions more objectively. I myself used to work in healthcare, and when I came to Northern Cyprus, my opinion of the medical system here was very poor. I'll explain why. Because when I arrived here, literally in my first year living in Northern Cyprus, as a healthcare worker and someone who knows English, I was approached by an important person here, a member of parliament. He invited me to go with him and his Russian-speaking girlfriend, who didn't speak Turkish or English, and to help translate at the doctor's office, so that it would be more or less confidential without having to call in a local interpreter. And so that we could translate properly and have a normal conversation, we went to this doctor, a gynecologist, and the girl was examined. I was translating and I asked what she was saying. She mentioned infections. Well, what kind of infection? As a healthcare worker, I know that this infection is treated one way, that one another way, and if there are 2 of them, they need to be treated according to a different protocol. If there are 2 of these, and then there's a third one that's treated in a completely different way. The treatment regimens were very expensive back then. In the post-Soviet region, treatment cost an insane amount of money. It was equivalent to several average salaries. And here they just tell me she has an infection. Well, that's not an answer at all, in my opinion. They say she just has an infection. How did you find out that she has an infection? You just took a look. Where are the blood tests? Where are the swabs? Where's the lab? We arrived here just 20 minutes ago. It's an infection. Here are the medications. Buy them and treat her. I thought this was just rock bottom and a complete lack of understanding of medical issues. This girl took the medications that were prescribed. She didn't have to pay for them. That would have cost several average monthly salaries if it were in Russia or the post-Soviet countries. She got better and there were no problems at all. I was really surprised at the time. The second case was when I was giving blood. I told you that we go through a medical checkup every year. At that time I had either a work or a business visa. I went to give blood in order to open it for myself. They drew blood from my vein. They took blood from my vein, gave me a cotton ball with alcohol, and I applied it. And they said, that's it, you're free to go. I said, what do you mean, free to go? We're talking about a time 20 years ago, just so you understand, maybe in the post-Soviet space. Now everything has changed too. But at that moment, I was really shocked. I said, what do you mean, free to go? You're letting me go with this cotton ball that has a drop of my blood on it, right now, out onto the street? Are you out of your mind? What if I just throw it away right now? What if, God forbid, there's an infection from one of your patients? What if it ends up in the water and spreads? I mean, I was voicing all those fears that existed in the healthcare system where I worked. They looked at me very strangely, but I know there's a container for these cotton balls. No one is allowed to leave without using it. You have to throw it in there, throw the syringe in there too, and dispose of it in a special way under supervision and sign a special logbook. Here, they also looked at me strangely, but let me go with the cotton ball and everything was fine. I realized that medicine here is just different. I thought it was rock bottom, but it's just different. Then, when I worked with some medical staff, I saw patients, including people over 80 who were almost perfectly healthy, but that can't be when I was seeing a patient. In Ukraine, a woman under 30 comes in, she hasn't even had children yet, and she already has such a long list of illnesses that you could make money treating her for years and years. In other words, you could keep treating her for years. But here, pensioners come in for an appointment and there's really nothing to treat. Because they're healthy. Here the air is different, the food is different, there's no stress, and that's the reason why. It's a system of effective medicine. In general, I originally had a poor opinion, I'm telling you sincerely from the bottom of my heart, about specific cases and why I came to these conclusions. But today I see that yes, indeed, the doctors are professional, the medicines are effective and the equipment is there. They have enough to make the right diagnosis and then they have the knowledge to cure people, which is why people here don't get seriously ill very often. There are no severe infectious diseases and life expectancy is very high. So if you want to live in a region where being healthy and happy is much easier than in other places on the planet, contact us to buy real estate. We'll be happy to help you with everything. The link to our website and all our contact information are in the description of this video.